Hello, everyone, and Happy New Year. My name is Tara Loyash. I will be sharing information on bibliotherapy as an intervention specifically for rec therapists, working with family caregivers. So we do a lot of research and a lot of programming around our clients, but usually we don't really think about caregivers, especially family caregivers, as our clients and individuals that could benefit from the services that we provide. So we're going to be talking about caregivers, and we're also going to be talking about bibliotherapy today. All right, so what are we hoping that you learned today from this presentation? We're going to talk about the history of bibliotherapy. We're going to describe the benefits of bibliotherapy specifically as a recreation therapy intervention. We'll talk about the API process, and then how you can design your own intervention using bibliotherapy for family caregivers. We are going to talk today specifically about family caregivers for persons diagnosed with dementia, Alzheimer's, and different types of dementia. So that is my background. I worked in long-term care for about 18 years. Part of that was also in memory care. And a lot of my research focuses on providing services not only for individuals with dementia or those that are aging, but also family caregivers, and also looking at ageism as a component to the care that we provide, which, if you haven't already listened to that presentation, that's also on the list for our winter session. All right, so first we're going to chat about why caregivers, caregiver burden. Some of you might have heard that term before. We're going to go into that. Like I said, the history, and then using bibliotherapy as an intervention. What types of research are out there? I'm going to share my research that I conducted a few years ago, and the type of intervention that I created for family caregivers. Okay, all right, so let's get right into it. So why recreation therapy for family caregivers? So we do have a large amount of recreation therapists that are working with older adults. That could be in long-term care, that could be in adult health centers, also rehabilitation facilities. So we have individuals that are our recreation therapists that are focusing on older adults. But even those of you that don't necessarily work with older adults might come across older adults within your practice. If you're just working with adults, or if you're working with children, you'll be working with their caregivers as well. And even if you aren't working with older adults, there's a good chance you are coming across family caregivers that you're interacting with. So there definitely is a need to offer assistance for this group. That's something that recreation therapists can certainly do. Our caregivers, specifically those who are taking care of individuals with dementia, they've actually reported that there's inadequate support services from providers, which kind of makes sense because providers are focused on their patient, not necessarily the caregiver of the patient. There's generally high caregiver strain. And then there's low confidence in managing different caregiving duties. And we'll get into that a little bit more about how the relationship between the caregiver and the loved one changes as their diagnosis of Alzheimer's or a related dementia progresses. So what exactly is caregiver burden? Some of you might have heard this term before. It's that stress and that strain that caregivers are perceiving in a home situation, which certainly makes sense. So as a loved one that you're caring for, as they require more help and assistance, that would place more stress and strain on you as a caregiver in your routine, your daily routine, but then also your relationship with that person. So our caregivers, they're usually experiencing fatigue, anxiety, stress, and then they have a lack of coping skills along with that. There are some caregiver support groups out there, but certainly not enough. And those are for caregivers that are actually able to take time away from the person that they're caring for. So there are a lot of individuals that are caring for children, and then they're also caring for aging parents. So there isn't usually a lot of time available for them, to participate in some of these resources. And sometimes they're not even aware that these resources are out there. So this might be something that you would like to do for caregivers, depending on where you work, adding a group for those individuals, which can certainly help with family dynamics. So our caregivers with patients with dementia, 39% are suffering from depression. 61% are rating the emotional stress of caregiving as very high. And more than half feel that they're on duty 24 hours of the day. And this is information that was gathered from the Alzheimer's Association. So we do have our caregivers that are really feeling stressed and overwhelmed. And that can certainly add to their feelings of burden. And that's where we, find ourselves in the situation of caregiver burden. Okay. All right. So specifically those family caregivers that are caring for people with Alzheimer's disease. Alzheimer's disease is the sixth leading cause of death in the United States. We have a good amount of individuals that are diagnosed with Alzheimer's. And in relation to that, we have a good amount of individuals who are providing unpaid care for individuals that are diagnosed. And these are mostly family caregivers. So 15 million Americans are providing that unpaid care for individuals that have Alzheimer's or Alzheimer's related dementia. So 23% are over the age of 65. So they're also older adults, and 62% of are women. So there is a significant difference in the roles that people take on based on their gender. So there could be that expectation that women are expected to take on that role. That certainly doesn't mean there aren't male caregivers, but we do see a significantly higher number of women who are taking on this caregiver role. And again, we're specifically talking about caregivers who are unpaid. So these are family caregivers, certainly not caregivers that are working in different facilities, although certainly there's stress and burden that's, individuals can feel burnout at work. But this is specifically for those family caregivers. All right, so let's chat a little bit about bibliotherapy. We're going to get into the history. We're going to talk about exactly what it is. And then we're going to move on to how to create a program based on bibliotherapy or using bibliotherapy as an intervention for individuals. All right, so what exactly is bibliotherapy? Some of you might have not heard of the term, but you're probably familiar with what it is. So it's essentially the use of film, literature, journaling, poetry, to assist clients in coping with different life changes. That can include emotional issues and also behavioral challenges. Bibliotherapy can also be referred to as reading therapy, book therapy, or even literature therapy. So you're probably more familiar with what it is than maybe what the specific term is. But really, there's a lot of different components of bibliotherapy. So there's different ways to use this intervention. All right, so I just wanted to share the history of bibliotherapy because I always enjoy learning about the history of different interventions and actually anything. I'm a little bit of a history buff. So even in 300 BC, the ancient Greeks and Romans, they considered libraries to be a healing place, right? A healing place of the soul, which is so nice to think about. So think about when you step into a library too, how quiet it is, and hopefully how welcoming it is. So really, since a long time, we do have this history of seeing books as healing, as a way to expand your mind, as a way to maybe escape realities as well. If we move along with our history, let's see, actually had research that was conducted in 1937 at VA hospitals by Elizabeth Pomeroy. So she was able to start doing research on bibliotherapy to see the benefits of that. We also had our first publication on bibliotherapy for children. That was in 1946. 1950 is a big year because we have our first model that was created that involved bibliotherapy. So specifically imaginative literature to elicit a certain reader response. And we'll move into that in our next slide as well. In 1980, it suggested that bibliotherapy is an effective practice. And in 2005, right, not too long ago, there's actually a bibliotherapy evaluation tool, the BET, that was developed, and we'll go into a little bit more of that as well. All right, so moving on to our model in the next slide. This gives us kind of bibliotherapy in a nutshell, right? So our readers are moving from identification to catharsis to insight. So with identification, that's when we maybe first pick up a book, right? And we find something grabs us, something is interesting about it, right? So maybe we identify with the main character, maybe we identify with one of the side characters, maybe we identify with where the story is taking place, right? So we start reading the book and there's this identification, right? Kind of this connection, right? We move on to catharsis, right? So you're feeling what those individuals are feeling, right? So you may, understand why someone is mad at another character. Maybe that relates to what you're going through, right? And then it feels good, right? To feel that through that character. And then hopefully moving to insight. So once you've identified with a character, you're feeling what that individual is going through, you're understanding that situation, right? Then there's that insight. So if this person can get through what's happening, maybe I can do that. Or I didn't realize I felt that way. Or you know what, I would have handled that differently. And it's good to know. Maybe you feel, some type of compassion or, some type of comfort. It's good to know that I'm not the only one who is going through this experience. So with our Schro's model, right, from 1950, identification, catharsis, and then insight is a process of really embodying these characters, right? And then being able to apply what, you're reading to yourself, right? To move on and then hopefully assist. All right, so think about your favorite book. So if we were actually in person, I'd be asking everyone what their favorite book is. I put up a few that I really have enjoyed in the past. Handmaid's Tale is probably one of my favorite books. And I do love David Sedaris. If anyone is a David Sedaris fan, then you definitely know why. And then I actually chose two different books, children's books that I enjoyed reading to my kids, Farm Fresh Cats and The Paper Bag Princess. And I do enjoy a little bit of adventure. So Hunger Games has always been one of my favorites. I've recently gotten into Game of Thrones. But I do, even though I'm an adult, I do enjoy those young adult books as well. So think about your favorite book, what you enjoy reading and why you enjoy that, right? And so you could have, a list of different books and they can be completely different, kind of like this list here. But think about the main character in that book, or think about why you really enjoy that book. And is it because you relate to that character or a certain character? Is it because it's a way for you to escape, right? So maybe when I'm reading The Hunger Games, it's certainly a way to escape, what's happening in my daily life and something a little bit more exciting in a safe way. And then also, even with our children's books, what do we learn from The Paper Bag Princess? And the reason I love this book is because at the end of the story, the princess saves herself. And so I really enjoyed reading that to my daughters. And then Farm Fresh Cats is just super silly. And so, I had a good experience reading that with my kids. That was one of their favorite books. So then I, in turn, enjoy that book as well. So think about why you enjoy the books that you do. What is it about them? So again, is it the character? Is it the stories? Is it the use of sarcasm in order to kind of process what's happened in your life, like David Sedaris so brilliantly does? So think about that. And this is an important step because when you are designing a bibliotherapy program, you first want to be able to choose the right book, right? You want to make sure that the book you're choosing is going to connect with your client, right? It's a type of book that they like. It's going to connect with your client. And then you'll be able to use that almost as a tool, right? In order to meet that individual's goals, right? And we'll certainly get more into that. All right, so there are different types of bibliotherapy. There's 3 different types. We have our clinical bibliotherapy. All right, so that is where we want our clients to have some insight to the behavior, right? And why maybe that behavior needs to change. So usually with clinical bibliotherapy, imaginative literature is best used. So maybe even playwriting, right? So writing a play and then performing it, or creating your own stories, right? So that's ways that we can develop our own characters that maybe are going through the same thing, something similar with our client. And then through that character, we can address those behavioral changes. There's developmental bibliotherapy. The goal for that is to maintain emotional and mental well-being, right? So maybe some of us, a good amount of us, have read a self-help book, right? So maybe you're feeling a certain way, and you go to the bookstore and think, this could really help me, and I need to know about X, Y, and Z. Right? So we're trying to maintain our emotional and mental well-being, right? We want to develop further. That's usually our self-help literature. And then there's client-developed bibliotherapy. So the goal for that is to understand the cause and effect of actions. So if I'm doing X, Y, and Z, then this is what's going to happen, right? Or this is the consequence of something. And this is where our client can actually become part of the story. So maybe if they are relating to a character in a book, they can have some type of conversation, right? Maybe writing a letter to that character, or imagining 2 different characters that are having some type of disagreement and writing, having those characters write one to another. So those are just an idea of different categories of bibliotherapy and how bibliotherapy can be used with your clients. And again, that's going to depend on client need as well. All right, so what are some of the benefits of bibliotherapy? There's actually a lot, and those benefits can be beneficial to different groups as well. So bibliotherapy, we're talking about caregivers and older adults today, but really bibliotherapy can benefit children, adolescents, our veterans, also our caregivers, right? So there's so many different populations that are benefiting from bibliotherapy. We look at those benefits, we can see increased self-awareness. We can hopefully decrease stress, anxiety, and also loneliness, right? So some of you who might even belong to a book club, that helps increase social interaction and decrease loneliness because we're with individuals that have, that are reading the same book. It gives you a topic of something to speak about, but also, you're meeting people that have the similar interests as yourself. Bibliotherapy can increase coping skills, increase self-esteem, and also maturity. Decrease negative behaviors too. So maybe if someone, was reading a book about an individual who maybe doesn't have the best behaviors or is engaging in negative behaviors and seeing the consequences of that, if they maybe, they're engaging in the same type of behaviors, it's a way to talk about that as well. So we could see that decrease in negative behaviors. Increased empathy and appreciation. It can help with identity development, right? So who am I? We talk about that self-help books. If we're using that type of bibliotherapy as a way to kind of increase our mental well-being, right? It could help with that identity development and also expression of emotions. So for some people, it's very hard to express emotions. Some people don't know how. For anyone who has lived with an emotionally immature parent, those are skills that just, aren't learned when you're younger. So it's difficult to express emotions, and it could be out of fear for how you might, be treated at home. So being able to express emotions through another character can help that client express their own emotions. All right, so some considerations as we move towards creating our own intervention of bibliotherapy. You want to first obviously think of our clients, right? So person-centered, person-focused. Think about cognition and also development. So what is their reading level, right? How much are they able to concentrate? What is their diagnosis? Is there anything that's going to prohibit them from being able to participate in the way you want them to, right? So bibliotherapy isn't necessarily for everyone. It's not kind of a catch-all, but the individual should be able to have some level of concentration in order to participate in bibliotherapy. Think about language as well. So do you have primarily English speaking clients? Is it Spanish speaking, a different language? If that's the case, then how would you address that? How would you make bibliotherapy work? And then in conjunction, like I said, with reading level as well. And we'll get into comics and graphic medicine, which is really interesting in a way to, if someone has a lower reading level, pictures are a way to substitute content, understanding of content, or to help understand content. So understand reading level as well, because you don't want to give someone a book that's above their reading level and then they become frustrated. Think about their interests, right? What are they into, right? Are they into fantasy? Would they like Game of Thrones? Would they like Hunger Games? Are they into poetry, right? What are some things that they like to do? And there is an evaluation tool, the BET, we'll chat a little bit about that as well, that, can help with that. Make sure subject matter is appropriate, right? And then you also want to choose the genre. So are you going to choose something that's fiction? Are you going to choose nonfiction? Are you going to choose graphic novels? So there's a lot of things to consider before you're choosing the book for your clients. And certainly, maybe you want to choose something that you've already read that you're familiar with. So you know what's in the book, but you don't want to push a book that you like on someone else just because you enjoy that book. All right, so speaking of comics, we're going to chat a little bit about graphic medicine, which I think is so interesting. So graphic medicine, if you haven't heard of that term, it's a use of comics as a way to educate individuals, as a way to portray a medical experience. And it's really it's almost like advertising in a way, but use of graphics. So research has shown that combining pictures with text enhances a reader's understanding of the message that you're trying to portray. It's a way to help people also understand what to expect, right? From certain diseases, what to expect from, certain medical procedures, right? So there's an example here. And I like this one, right? So adding veggies makes you a hero to them, right? And we've got the message pretty much, right? That our super moms should be giving our kids veggies because look at that kid, you must love us. You're giving us veggies, and oh, this is great. This chicken is great, mom. So this is aimed towards parents, right? So encouraging parents to feed children vegetables and essentially healthy foods. So this is a way to portray that reader understanding, right? Because we could easily say, just give someone a sheet, run off that says, these are the reasons why you should, give your children vegetables. This is easier to read. This is certainly, more captivating too. It gets someone's attention. All right, we can also educate with graphic medicine. So some of these examples that I've put here are actually really interesting, and they were created by family caregivers that were caring for someone with cancer. And not only is it educational for the reader, but it's also beneficial for the person that's creating this content, right? So our first one on the left is about getting information about cancer treatment, um, and how important it is to bring a tape recorder. They've learned from experience, bring a tape recorder to an appointment. So before the dreaded core biopsy, Dr. Mills fills us in, right? And so everything's a blur, but there's these certain words that are coming out that you remember, but you're not gonna be able to remember everything because you're in shock. And that happens to a lot of families, certainly. So this is a way of kind of expressing that and maybe that frustration around that. Um, and then for someone who's going through this to read this and to say, oh, that happened to me too. I felt the exact same way. It's extremely beneficial. The one on the right is one referring to chemo. All right, so this person is comparing chemo to kind of a balancing act at a circus. So it says chemo kills good cells as well as bad. Mom needs to make more red blood cells, but not too many. So she has drugs to thicken, drugs to thin, right? And a witch's brew of tongue-tangling trademarks, right? Those are our different medications, right? It's a spectacular trial and error balancing act. And individuals going through chemo could probably, relate to this, certainly. So again, for someone who's frustrated watching his mother go through this treatment and creating this is beneficial. And then for someone who is, going through this as well and comes across this comic strip, can feel as though they're not alone, right? So in a way, it's also educating too, because we're learning we should bring a tape recorder with us to the doctor's office, but also that there is a balancing act with chemo, right? So some drugs are doing one thing, other drugs are doing another, right? It's this balancing act as well. So I really like these two. They give us a nice example of graphic medicine in relation to very serious topics. Okay. All right. So applying bibliotherapy in recreation therapy practice. So the bibliotherapy process, it really mirrors the API process. So it's theory driven. There's a theory behind bibliotherapy. There's an assessment that we need to conduct, right? So we need to understand what an individual enjoys, right, in order to choose the book for them. And we need to really even assess if they're ready to face those issues. The last thing we want to do is to, have them read or participate in a book that is facing issues that they're not ready to face, certainly. We're selecting that appropriate story once we determine that they are ready to face those issues. We're implementing, and that could be guided reading. And that's actually what I did with my group, and we'll get more into that. But keeping everyone reading the same chapter, and maybe even reading some during our time together, right? And then evaluating, right? Were our goals met? And usually this bibliotherapy can also be used with reminiscence therapy and then also expressive arts. And I did bring both of those concepts, both of those interventions in with the bibliotherapy program that I developed as well. And I think some of these things just come naturally also, especially that reminiscence therapy. Okay, so I've mentioned our bibliotherapy evaluation tool a few times. So here it is. It is the BET. It was developed in 2005. It's a framework for evaluating the possible use of a book for therapy. So it guides practitioners to determine what the benefits are using a book and maybe what are the drawbacks of using that book. So it's very subjective in that there's a lot of open-ended questions. So it's not necessarily, you're answering questions and there's a score and then you can determine, yes, this is great or no. It's very subjective. So you as the individual needs to just be aware of your bias towards that book. But it definitely is at least a starting point for choosing a book that is appropriate for your clients. All right, so now let's get into bibliotherapy as an intervention. All right, so this is specific research that I conducted that I'll share with you. Um, so my focus was on caregivers of persons with dementia. That was my target audience. I wanted to use bibliotherapy for that group. And what I really wanted to do was to determine if bibliotherapy would reduce caregiver burden or that perceived burden among family caregivers of persons with dementia. And I specifically wanted to do that in a group setting. So I've determined, and probably at the end I can chat more about this, that I probably would have had more participation if I made it a little bit more accessible, but I'll get into that. I'm getting ahead of myself now. So I wanted to reduce symptoms of caregiver burden, so that anxiety, that stress, that fatigue that individuals are experiencing. And in order to measure that, I was going to use the caregiver burden inventory and use those scores. So this was a pre-test, post-test design. It was IRB approved. And then I partnered with an adult day health facility that was nearby, which was great. So the results of the study were published, and I have the citation here if you want to check that out. All right, so I use caregiver identity theory in my research. So caregiver identity theory, I feel like, again, it was not developed too long ago, 2007. Caregiving is really this dynamic process where there is such change in your relationship with the individuals that you're caring for. And that's essentially what this identity or what this theory says, is that your role is going to change as your loved one's illness progresses. All right, so we can see in phase one, and we're looking at our caregiver role, right? The individual. So in phase one, and we'll suppose that you found out that your spouse, was diagnosed with cancer or diagnosed with dementia. So your role in majority is spouse, right? And maybe a little sliver is caregiver. Maybe they need some reminders on medication. Maybe you need to, you're going to the doctor's visits with them, things like that. Phase two, your caregiving role is increasing, right? And so in relation to that, your role as a spouse is decreasing. Phase two, we're half and half, right? So half the time you're feeling like your identity is spouse, half it's caregiver. When we get into phase four, that's when it's a majority of caregiver, right? So you feel more like a caregiver than you do as a spouse to the individual that you're caring for. And that's when we can see that increase in burden and anxiety, which is really detrimental to that relationship with that person. And a lot of family members who, are caregivers and are experiencing that phase four, a lot of them miss being able to just be a spouse or just be a son or just be a daughter to their loved one. Phase five, right? We're back to being spouse most of the time. This phase is when the individual, the caregiver will seek assistance. So either have someone come in or have their loved one in a facility, right? Moving into a facility. So, that can kind of help even out the balance a little bit. So there's still a little bit of caregiver, because even if, say, someone, their needs are so great, you can't meet them at home. So you have moved them to a facility, someone, we'll say someone with dementia or, or Alzheimer's disease. You're visiting, right? But in some ways you're still caregiver, because you might be organizing their medication. You might be going to care plan meetings. You might be bringing, doing their laundry because maybe you enjoy doing that for them, right? So there's still that part of caregiver, but because you've gotten assistance, you've gotten help, and that again could be either, a significant amount of help in the home, or they've moved into a facility. You're able to rebuild that relationships that's more spouse, and enjoy that connection with that individual, and hopefully reduce that caregiver burden. perceived caregiver burden. All right, so for my intervention, because I was focusing on caregivers of individuals who are diagnosed with dementia that are caring for them at home, I chose Alzheimer's. It's Alzheimer's Through the Looking Glass. It's a graphic novel by Dana Walrath, which I absolutely love. I use the bet tool to choose a book, and this one seemed to work really well. So I specifically wanted something that wasn't too long, because I knew my caregivers wouldn't have a lot of time to read, something that was visually interesting, and also something that they could potentially relate to as well. Right. So within using that bet tool, right, I found that it was age appropriate. It also represented the group, right? What I really liked was it was written by a caregiver whose mom was diagnosed with Alzheimer's disease. So it's essentially her journey caring for her mom. And if you look closely at, this is Alice, the main character in the book, her bathrobe was actually created by strips of Alice in Wonderland from the actual novel. So I thought that the author was, had a great story, but it was also very creative, and something that I could work with for, bringing in different activities into the intervention as well. So there were short vignettes, right? So the book itself wasn't very long, but there were very short vignettes. So even if you only had, maybe 10 minutes to sit and read, you'd be able to do that, right? And then also the topics, they address different stages of caregiving, the caregiving identity theory, because it was the story of the progression of Alice needing more care. All right, so who was able to participate? So when I was working with the Adult Day Health Center, I was working with a social worker, and she helped me choose individuals that would be appropriate, that she felt would be appropriate or interested. So she was able to find 18 potential participants. So I sent out a mailing to those individuals. I also had an open house at the Adult Health Center. So if anyone had questions, I could answer them for them. I feel like this is, can be a sensitive topic. So it's, it's most important for them to be able to meet me first and ask any questions that they could have. So they need to currently be caring for a family member that was diagnosed with dementia. They had to be over 18, be able to follow verbal and written directions, and then sign a confidentiality agreement. My plan was to have 6 different support sessions, 1 hour per week. So kind of a support group. I wanted the group to be together, not only so they could read on their own, but then we could come together and discuss different topics. And also they needed to be receptive to bibliotherapy, because if I wanted people who wanted to participate, essentially. So I wanted to make sure that it was clear on my expectations that individuals should want to be there and not feel like they have to be there. All right, so instrumentation to measure all of this, I use the Caregiver Burden Inventory, the CBI. So the CBI has different factors. So they ask questions that are based on time dependency, development, physical health, emotional health, and then social relationships. So it's a quick little survey. So I had them fill this out before our first session, and then also after the 6th session. So I did like that this was a quick survey for them, but then there were also those different dimensions. And this one is specifically aimed at reducing caregiver burden also. And I'm just going to increase that a little bit so you can see some of the questions. There we go. So the higher the score, the more likely someone is experiencing caregiver burden. And if someone's total score is above 36, that indicates that there's a need for respite and other services. So even if not using this, to conduct a research, is a great way to take inventory of caregivers and the burden that they might be feeling to see if they need additional services. All right. So what was my plan? So the plan was to meet for 6 weeks at the adult day health facility, which worked out well because it was convenient. The adult day health facility worked with me. So individuals that were coming, they'd be able to bring their loved one because sometimes it's hard to find care, obviously, because you're the main caregiver. So they could come and spend time at the adult day health center, even if it wasn't technically their day. Um, and then be able to engage in this group. So there was care provided during the sessions, essentially. So I was hoping for between 5 and 8. I wanted that cohort. I didn't want it too big. And also that's an ideal group for the topics that we're talking about. So I had 3 individuals that agreed to the study out of the 18 participants, so not the best return. But it was a good experience, and the facility where we had our own room. It was quiet, it was comfortable, there was private space. I had a laptop with Wi-Fi, so if someone wasn't able to attend in person, then they could sign in, say their loved one was sick or something, or they weren't able to make it physically, but they still wanted to be there. They could potentially do that virtually. All right, so my 6 weeks, I had 6 different topics. So I had the caregiver identity, the burden, grief, coping skills, support, and then resources at the end, because I want them to be able to leave the group with some tangible resources. So we would discuss personal perceptions of caregiver burden to begin with. Then we'd share previous week's experiences. Then we do different topics, right? So whatever we had planned for that day, I'd provide trigger warnings. Certainly, while we're reviewing that week's reading, we completed discussion focused on that reading. And participants were encouraged to find connections between their readings and their own experiences as a caregiver. And then we had a debrief. So that was essentially the format that I used for each week. And this is the sample 1 week that I did. This one was stress and support. So we reviewed the last session, and each session I broke it down. I broke it down like this so I could follow the session outline as well. But we reviewed the last session, and then, bring it all back to support, right? So how do coping skills relate to support? Then we talk about stress, right? How much of your stress is attributed to caregiving, right? How much of it is, you caring for this individual, for this loved one? And what's the best way for you to feel supported, right? And how can you verbalize this to others? Sometimes, the hardest thing to do is to ask for help, right? How do we verbalize that? And then there were assigned readings, right? So we reflected on those assigned readings. So it had different vignettes, right? And again, very short. And then we talk about the author, right? And her relationship with her mom, in relation to these readings, how they felt about that. What were examples of support? And then we had a small activity, so notes of encouragement. So I had them write a note of encouragement to a fellow participant, and then we would debrief. What information do you find of value today? What did you learn that you can apply this week? And one of the activities that I did for another session, there's a picture on the right here, is I actually brought in some older books, and they use the pages to make a piece of art, right? In relation to how they felt about their caregiving relationship. So that's an example also. And that mirrored the design in the book as well. All right, so results from this, because it was a study, what exactly happened? Was it beneficial? So there was a total of 3 participants, but 1 participant had to leave due to the death of her loved one. But the 2 participants that started the study and then ended the study, they experienced a decrease in their overall CBI scores. Since it was only 2 participants, it was difficult to determine if there was any statistical significance with that. But there were differences in the 5 factors. All right, and we can see that here, and I'll make this a little bit, if I can. Let me, there we go, a little bit larger. Okay. All right. So we saw a decrease specifically with time dependency for participant B, and the pre-test and post-test went from 14 to 7. And then for participant A, physical health went from 9 to 6. So there was there was a decrease in the scores, but again, statistically significant with only two participants. It was hard to determine, but at least something that was beneficial for the individuals that were participating. So limitations, clearly the number of participants, because at the end of the day, it was only two. I was the primary investigator of the study, but I was also the facilitator. So there is by chance that, they'd want to make me happy by, they knew what the study was for, by answering a certain way. Both of the participants were women that were caring for female family members. So we can't assume that male caregivers would have the same experience. And the data collecting really relied on self-reporting by the participants. So there could be that limited objectivity. So something to think about if you're actually doing a study with this. So considerations. So if you're thinking this sounds like a great idea, I want to move on and maybe do something with my caregivers, bring families together, maybe to start some type of connection. And you can do it, as a book club and just, bring in some of these concepts as well, which might really be nice for family members to meet each other. Think about reading level. Think about creating a safe space, right? So these can be very sensitive topics. There's possibility of people, having certain reactions, feeling triggered. So that safe space is really important. Possibly transportation to and from location. So the individuals that participated, they had their own transportation, but it could have been a reason why, some of the original 18 didn't decide to participate. Transportation could have been an issue. Also availability. What's the best time for individuals? Is it at night, or maybe individuals are too tired? Maybe it's a time when their caregiving is most difficult. Is it during the day? Is it on a weekend? It's really going to depend on their caregiving schedule, which can be difficult to work around, right? And also qualitative data. So moving forward, if I were to pursue this some more, I would certainly involve more qualitative data. What I collected was all quantitative, but that qualitative data is so important to really understanding each person's experience and how that relates to their caregiver burden. So thank you all so much for joining me today to learn about caregiver burden and bibliotherapy, and how bibliotherapy can be used as an intervention for caregivers. My information is on this slide here if you'd like to reach out, if you'd like the slides, or if you have any other questions for me. So have a wonderful day and be safe.